Hello all. So today we are going to see a design thinking video. How we are taking our classes in a DT based learning. So our students will be enjoying from the smart board and other classwork like things. Okay. So this is a debate session and today we are going to have a debate on the low back pain. So which exercise or which treatment will be helpful. So in our presence, we are having our third year student Emmanuel Benjamin, and this side we are having a third year student Prasanna also. So both of them are going to have a debate which will be effective for the low back pain. We're going to see this video in a enjoying and the initiative and innovative manner. We'll wait and see which will be the most important thing for the low back pain.
In worldwide, millions of people were suffering from low back pain. So I suggest that manual therapy we can go with no medications, so we can avoid many contraindications to the patients.
Yeah, I agree with that, but there are a lot of benefits in we are using a modalities. By using modalities, we can treat a lot of pain and conditions by making a thermal effects.
Yes. Yeah, I agree with that. But we can build trust with the patient by spending more time with them.
Will you think that the manual therapy builds more trust in between the patients than the electrotherapy?
Okay. You see, in the treatment protocols of electrical modalities, we have only less time to treat the patients. But with the manual and mechanical therapy, we have more time of contact with the patient. So we can build their trust and we can give them emotional support to the patient. So which makes the patient to feel the reduction of pain psychologically.
Yeah, but I agree with that. But we are also giving a painless treatment to the patients by using a modality, and we also giving a psychological talk to them near them.
Yeah, actually, you see, I'm asking you a question. Many patients will have the fear of having some kind of applying electricity to their body. So, in that situation, how will you treat them?
Yeah, that's why we are giving basic information about the modality to them and how we are having precautions about that, and we are clearly explained to them. That's a main thing.
Yeah, that's why I'm telling. In this kind of manual therapy, there is no need of fear, no need to fear, because the patient can feel free to contact with the therapist because it's only uses our physical hands. There is no contact with the electricity. There is no afraid of shock or some kind of physical blocks.
Yeah, okay. We are having advanced modalities like IFT, TENS, and the lasers to treat the patients with a more effective way.
Okay, let me tell you with the clinical relevance and the research papers. Here we have many journals that supports that manual therapy gives more in the long-term goal to get the better results to the lower back pain. Where the American Physiotherapy Association were telling that spinal mobilization and manipulation gives the better effects in lower back pain in a long-term goal. Okay. Then we have McKenzie, okay, with the Maitland with grades from 1 to 4. Then we have assisted soft tissue mobilization. Then we have myofascial release. Then we have such kind of hand manipulations which we can give the patients. And here we have muscle energy techniques where we give the treatment with the help of the patient's own muscles, which builds the confidence to the patients like that. Yeah, I can do this movement. Yes, I can build. So by giving this, the people can get the psychological of yeah, we can do it. So the people gets that of their psychological box will be get over. I think so.
Yeah, one question. How will you maintain the time management?
Okay. Yeah, you are asking this question like with the electrical modalities, you can give that like to the maximum time is up to 15 minutes. Okay, here we have in this manual therapy, we need to have more time with the patients, which builds their time with the patients, which able to connect with the patients. Okay, then by this we can increase the reputation and we can get more connection from the patients. Like the patient can tell, yeah, that therapist does like this. He gives me motivation. Such kind of things we can get from the patients. So I think time management is apart from that, but building the connection and reputation that matters.
Yes. So today we saw a beautiful debate based on the low back pain among the electrotherapy and also with the manual therapy. Yes, you might have saw this video, and this is a mind-blowing debate. Like, I have not even faced these types of debates in past years, and this will be the good one. And the final talk will be the manual therapy holds on with the good strong support with the journal evidence and also with the patient's clinical feedbacks. Okay, and also we are having the electrotherapeutic modalities also giving a good thing, but hold on with this is the manual therapy. And thank you guys for this wonderful debate, and we'll meet on the next video. Thank you.
Pleasure, sir.
Thank you all.